Now we will discuss how to move a tooth. To move a tooth, you just simply click on the tooth. When you click on a tooth, arrows appear. When you click on each arrow, the tooth will move in that direction. Notice the curved arrow. When you click on this arrow, you rotate the tooth. On this table, which is located on the right side of the screen, you can see the amount of movement that has been applied to that tooth from the initial records. You can also enter numbers if that's your preference, or you can just move the tooth and see how it looks afterwards. To move a tooth gradually, you can click on the arrow. Each click on the arrow will move the tooth by one step, or you can just hold the arrow and drag the tooth in the direction you want it moved. Now, we will discuss tooth movements with Brava versus auxiliary tooth movements, which are in addition to Brava and performed by the doctor. When you open a treatment plan, you'll see the auxiliary button near the bottom of your screen. When you click on it, you'll see two separate bars. The top bar, which is blue, shows tooth movements performed by the Brava appliance. The lower bar in green shows auxiliary tooth movements, like molar distalization, segmental mechanics, or midline correction. Auxiliary tooth movements are performed by the doctor and are critical to achieving the projected treatment plan. For example, in this case, Brava aligns the teeth and makes a nice arch form for the patient. The auxiliary tooth movement bar addresses the relationship between the upper and lower arches. It moves each arch as a single object. In this example, there's a lot of overjet and the case is class 2. After moving the auxiliary bar, you can see how the overjet is now reduced and the molar relationship is now class 1. So, auxiliary movement shows how the upper and lower arches are moving in relation to each other when the doctor prescribes patient elastics or other force modules. For example, in this case, there's an anterior open bite. After the auxiliary tooth movement, using prescribed elastics, the arches are now in occlusion and the bite is closed. Next, we'll discuss how to evaluate treatment plans.